Aaliyah, and this is our second year in the pre-med track at Independent, and we're sophomores. Today we learned about hospital operations and the different jobs that you can have not directly interacting with patients.
I'm Lauren, and over the summer and during this next school year, we're going to be going to the VA and shadowing people.
So I think what we are most excited about with this opportunity is how we can see this all glued together, like Lauren said, when we get to go and experience this in real life in the hospital, and also the opportunity that this gives us as pre-med track students.
What we've talked about prior. So all of those fall under our therapeutic services and
so high I'm hypnotized. What's up is down, what's left is right. Chasing stars.
So you've got two parts of this class. You have this week that's in class with your instructor, your adjunct prof, and then in August, beginning of August, you guys will actually spend a couple of shadow days at the VA in area and see operations. So things you're going to hear this week, and I believe you got a panel on Thursday. You're actually going to go in August and be with those folks and spend time with those folks. So I was telling Dr. Drew, I want him to spend some time with the CFO and the COO when doing his shadow days. So you can see what they do and interact with them. For those of you guys who know what field you want to go into, again, to see it firsthand, sometimes what you're going to find out is absolutely, it confirms, and sometimes you're going to I thought it was going to be more exciting. No, I don't do that. I think about this. And so we want you to get that hands-on experience. That'll be that first week or so in August. Ms. Tennyson will communicate with you, as well as Ms. Miller, on what days we'll be there at the VA. You'll dress professional. You'll have some notes. We want you to represent yourself, your family, and the school.
the other side of healthcare, right? I know a lot of you guys want to go down that pre-med track and you want to become doctors. But there's a whole world out there in healthcare, and so it's kind of what I want to introduce you guys to this week about healthcare operations and what that entails outside of actually physically touching a patient.
We have clinics, small outpatient clinics in very rural areas. We have one far away, it's Liberal, Kansas, which is 4 hours away. We have one in Hayes, 3 hours away. Dodge, 2.5 hours away. Salina, about an hour 45 minutes. Parsons, another 2.5 hours away. And Hutch, which is 45 minutes away. But we have patients who need appointments that does not necessarily require them to be touched, like counseling sessions. So rather than have a patient drive 4 hours for possibly a 30-minute appointment, we implemented telehealth. So these patients we first set up small clinics that could go in there.
So I was going to talk to them a little bit about logistics and what that means and what you do every day.
So I lead the team that purchases and manages medical supplies to include distribution. Ms. Andrews?
You have a hearing aid, like I do, two, okay? So that is a prosthetic device. Have you driven around Wichita or been around Wichita? You see all these aluminum ramps out in front of people's houses so that they can roll a wheelchair up the ramp. That wheelchair ramp is a prosthetic device, according to the VA. And we put in about 60% of the ones in the Wichita area. Okay.
No matter what area you go into, there's always going to be that business element, because then you have to think about that when you come out. Are you working for a private practice? Are you working for a hospital? There's research. You could go to school for like a university and teach it. There's a lot of different fields you could go into, and you're not going to know that today, but just keep that in the back of your mind. Ask some of those questions. We deal with that at our hospital. A big piece of what we do is trying to recruit providers and physicians. Well, it's competitive. You know, they're wanting to see where the money's at, what benefits can you get, are you going to pay for their schooling?
Hi, I'm Sean, and I just finished a medical administrative class, and what I took away was that, a healthcare situation and a building, it's very professional, and there are requires lots of organization and other parts, and everyone needs to play their role productively and efficiently for everything to be successful.
Hi, my name is Andrew, and what I took away from this class is that there's a lot more to healthcare than just doctors and nurses. There's a lot more that goes on. There's finances and the business side of healthcare.